Very good. So I just want to share with you a little bit about Dr. Libbie. She lives and practices in the Midwest. She's a small animal veterinarian, and she founded this awesome membership site called Wanderdog First Aid. And it's not only to teach you about first aid, but to help you master canine first aid. So, and her mission, or Wanderdog's First Aid mission, is to empower people to safely and confidently get outside with their dog and be able to handle any emergency situations that come up. And she's also a really gifted educator. She's also a really fun person, very knowledgeable, and she's sidekick to her white fluffy dog, Walter. So anyway, Libbie, thank you so much. And we're really looking forward to hearing what you have to share with us today.
I'm so excited, Jane. Thank you. Can't wait to get started. So thanks everybody for being here. It's fantastic. So.
All right, you're up.
I'm up. All right.
Yeah.
All right. All right. Well, I'll just go ahead and get started then. So I kind of broke this down into two parts. I wanted to talk about like facts, what we know right now, as far as this virus goes and your dog, because that's kind of changing. And then also too, so that's gonna be one part. And then the second part's gonna be talking about, you know, your veterinarian, your vet, how it's affecting your vet clinics and how it's going to impact you directly, and what you can do as a pet owner and as a community member to ensure that we mitigate this, you know, the virus, right? So mitigate the disease and the spread. So, so just to get started, get the ball rolling, because I don't want to take up too much of your time. Right now, in Hong Kong, they've been testing dogs, and some of you might have heard that a couple dogs and now a cat have tested positive for the virus, and I know that's caused a lot of concern. So I wanted to talk about that a little bit and what that means, because the tests they run are a little bit telling and what that means as far as how infectious your dog is. So in Hong Kong, I believe, my understanding was that if a person came up positive and they had an animal in their household, they would test both the person and the pet. And the government was doing that. So there was a 17-year-old Pomeranian and a German Shepherd that came up positive, and now more recently a cat. The Pomeranian actually died. That being said, it was a 17-year-old Pomeranian. At this point, we believe that it was not due. We're well informed that it was not the virus that caused the death. The dog had underlying heart issues and renal failure. It's important to discuss this though, because the dog was never symptomatic for the virus. And the way they test, the initial test is called a PCR test, where essentially they're testing the dog for different genetic components of the virus in the dog. And I hope that makes sense. If it doesn't make sense, just feel free to ask me about it and I can explain it further. But we're essentially testing for genetic material. And that doesn't necessarily mean that the virus is live and replicating. So this dog did come up positive on the PCR multiple times. And while this was a positive, it doesn't mean that the virus can replicate and enter cells. So when the virus can replicate and enter your cells, that is when it does its damage. And then that's when your immune system mounts a response, and that's when you have symptoms. And when you have the symptoms is when you become contagious.
So that would actually, just to interject here, that would mean that you're infected with the virus, as opposed to the virus just being on your fur, like I'm speaking for a dog, right?
Yeah, it's a very important distinction, because that's what this is essentially going to be broken down into two parts. So it's like, these pets that are quote unquote infected versus being fomites. And that's a very important distinction, because your dog carrying it on his hair coat would insinuate that he's a fomite, but he's not necessarily infected. So these pets, sorry, go ahead.
For people who don't know what a fomite is, it just means that something would be present on their fur, right? Like the virus could be present on the surface,
exactly,
desk surface, or, you know, something like that.
Exactly. And right now, I'm sorry.
No, go ahead.
Well, and right now we just don't know how long. Right now, it should just be assumed that it can last on your dog's hair coat for a couple hours, because if it can last on, you know, plastic and stainless steel surfaces for 2 to 3 days, there's no reason to not believe that it could be on your dog's hair coat for a couple hours. So this 2 to 3 day, you know, that's under perfect conditions. It's insinuating that, you know, there's no UV light, there's no, you know, environmental factors. So that's like perfect conditions that the virus is going to be on a surface undisturbed for that amount of time. So your dog is not going to be So that's why we're thinking it's a couple hours, and we don't know that for sure, but it's better to assume than like kind of, take a step backwards and be like, crap, we should have addressed that.
Yeah. So
So
my understanding, Libby, is that they believe that the virus was present on the coats of these dogs, not necessarily circulating in their bloodstream. Is that
yes,
correct?
that's a perfect segue because so they did these PCR tests and they were saying that, so yeah, hopefully they were hoping it was contamination, right? They did swabs of perhaps their mouths or their noses, or even rectally, and they were hoping it was a contaminant. But the problem was that the Pomeranian tested positive multiple times, insinuating that that's why they called it infected. The problem is as of March 26th, they actually ran blood on that Pomeranian, and they were able to test that dog did test positive for antibodies, meaning his immune system
Oh,
mounted a response. So that's relatively new information, and I tried to find more info on it, and it was literally a small blurb at the bottom of the I'm on a veterinary discussion forum, and that's all they told us, that the dog did. But I think I don't want it to cause any concern, because the public health officials are still saying that this isn't an indication that the dogs are giving it to the people. It's an indication that the people are giving it to the dogs. And this is probably right now we're assuming it's a 1 in a million, chance that this dog actually, his immune system mounted a response. So I don't want to be like a Debbie Downer and dwell on that, because I still think there's room. I mean, for example, dogs can technically test positive for our, regular flu virus, but it's very, very rare, and they're usually a dead-end host. So I want to classify infected versus infectious. Infected would insinuate that, yes, he did mount a smaller immune response to it. He did test, his DNA was found in the test, but he's not able to infect anyone else because he's not symptomatic. And when you're symptomatic is when you're contagious. And yeah, while you can be contagious a couple days before you become symptomatic, we're not thinking that's the case in dogs. I just want people to be aware of that, just in case down the road we are finding some dogs who are mounting a slight immune response to the virus.
okay. So for most of us, right?
Yeah.
We're self-quarantining.
Right.
My dog isn't going to a play group. My dog isn't going to the grocery store. My dog isn't even really, he's not even really socializing very much. So if I'm virus free and I'm healthy, then I don't need to worry about my dog somehow picking it up.
And that's why I think a lot of veterinarians are saying we should be treating our dogs like we're treating ourselves. Like, for example, our local bike shop is dog friendly and they're an essential service, and I need to go down and pick up my bike. Usually I take Walter with me to see the guys. He's not going with me this time. It's things like that. Like, normally he would go with me to the bike shop. Now he can't, because he's another potential one. He's a potential fomite, and two, until we have concrete evidence that this isn't truly, well, we're saying it's infected but not infectious, and that's a very distinct difference I want to make, because we know that the dogs can become infected, but we don't know that they can become infectious. And that's just going to be a matter of time, because we are doing surveillance testing here in the U.S. There's several different veterinary diagnostic laboratories who are doing kind of like a background surveillance. They have not been able to recreate those positive tests on the PCR. But they're also not testing positive households like they were in Hong Kong. So
I see.
So it's good because it's telling us that the test is very, sensitive, because there are canine coronaviruses. It would be a nightmare if they could cross-react, right?
Right.
So it's good because a lot of these, some of these dogs might have been vaccinated or exposed to canine coronavirus at some point, and it's not cross-reacting. So that part's good, because I know they've done, I don't have the numbers off the top of my head, but I know they've been doing the surveillance testing is quite extensive.
Here in the US since the coronavirus arrived here. Now, just so people understand, there is what's called a coronavirus that infects animals and dogs, but it is not the same virus that we're dealing with in humans currently.
Exactly. And there is a vaccine for it, but it is not going to protect your dog at all for the one that's causing the pandemic, for COVID-19. There's no cross protection.
Yeah, and there's no reason right now to vaccinate your dog for that other coronavirus, because it's not circulating and our dogs are not at risk for it. Correct?
Exactly.
Yeah.
Yep.
Okay.
So so yeah, I just wanted people to understand that, we are doing surveillance testing, but we can't really, we don't really, there's still a lot of unknowns because again, those pets that are being tested are probably being, those swabs that are getting sent in are probably because the dog has other respiratory symptoms, but it doesn't mean that they've come from a positive household.
Okay.
So,
So
so that might fudge numbers.
do you have an understanding of, uh, this testing that's going on of dogs and animals in this country?
Mhm.
How, what are they just randomly testing them, or are they dogs that are coming in that to veterinary clinics that are sick for other reasons?
So you would have to have a reason to swab those dogs, but we do see a lot of like kennel cough, especially in boarding facilities and doggy daycares. So what's probably happening is they're getting swabbed for influenza, like H3N8 for example, but they're not necessarily getting swabbed for COVID. But in the background, like they're not really publicizing it yet. They're not saying there's a COVID-19 test out there. They're just doing a surveillance in the background just to screen things and make sure that we're not getting positives on those PCRs. So they're probably coming in for upper respiratory infections due to like kennel cough.
Okay.
And then it's pretty much those, as far as I understand it, the veterinary diagnostic laboratories have kind of taken it upon themselves to start doing this surveillance.
Just to
So,
keep track of things. Okay. And
yeah.
so what does that mean for us? Like those of us that are doing our best to social distance and take good care of our animals.
Yeah, sure. So I'll start by saying that if you feel like you're symptomatic for coronavirus, or you are in direct contact, or somebody in your household is positive, then because of what we know so far, we still recommend that somebody else who's not symptomatic in the household takes care of the animal while that other person is self-isolating, if that's possible. And if that's not possible, and you feel like you might be positive, or you feel like you have symptoms, or you have been tested positive, then just again practice impeccable hygiene. Cleaning surfaces, not kissing your dog, not getting in your dog's face. Bathing, bathing if possible, things like that. And just washing your hands a lot. One clinic I know was even taking, like, so for example, if there was somebody who had traveled a bunch and they had that person brought in a sick dog, they were simply wiping down the main areas of the dog with a disinfecting wipe. Because if the contagion's on your hand, obviously it can get back onto the hair coat. So things like that to ensure that your dog's not a fomite. And then if you feel like you might be positive, and then other things as far as like social distancing goes, again, that kind of like the same principles that you're putting in place for yourself goes for your dog. I would say no dog parks, no Petco. I don't even know if Petco's allowing, like pet stores are allowing dogs in right now.
Mm-hmm.
Or if they're essential for those means. And like, yeah, people not petting your dogs. I was walking Walter last night and I came up on a group of kids, like they looked like they're all in the same family and they're playing in the street. I was just terrified they were going to ask me to pet Walter and I'd have to be that jerk, and just coming up with a good dialogue in your head, if that does come across, so you don't feel like, because it's socially weird right now, like not shaking hands, not hugging. No, you can't pet my dog. Like, and maybe you just say something like, I'm worried about my germs on my dog and you getting that, things like that. Like that was kind of the dialogue I formed in my head, just in case one of those little kids asked if they could pet their dog, my dog, so things like that, just to start thinking about. And it's just, we've never lived in times like these. So a lot of people don't know how to go about it, like in that social aspect. So, and then, and yeah, and just, socially, like walks are okay, depending on where you're at. I did read a veterinarian was concerned about people washing their dog's paws each time they come in the house. Like I've just gotten in the practice of taking my shoes off. You probably don't need to wash your dog's paws every time they come in the house. If it's sunny at all, those UV lights, that UV light is going to, kill the virus. It's not, while it can last on surfaces for a long time, we still think it's a pretty wimpy virus because it's an enveloped virus, meaning it doesn't, last in the environment forever like parvo does.
Right.
So that's good, but it still is somewhat more resilient than your typical flu virus. So washing your dog's paws are overkill unless he's been in an area that, had a lot of people, I would say. Like for example, I stopped taking, I take Walter everywhere with me when I go to vet clinics, and I stopped doing that. I bathed him and then he had to stay home. Just like and he doesn't get, he doesn't get to go places with me like he normally does. So just keeping
Right.
your dog at home, like, more than you normally would, which is kind of sad. So that's a really good starting point. Like if you're not sure, how to, just practicing those same social distancing rules for your dogs as you would for yourself.
Okay.
So.
All right, that's cool. And then also, like here in Santa Fe, we have an emergency 24-hour emergency
Yeah.
veterinary clinic. They've actually closed their doors. They're not open. They don't have any open hours at all. And my veterinarian is only open from 9 to 3 and only for emergencies, not for any routine type of thing. So it's really, really important right now that we all do our best due diligence to keep our dogs healthy, because we need to be just mindful of the fact that veterinary care is not quite as readily accessible as it normally would be. So share with us some things that we can do to make sure our dogs stay healthy. And I mean, we're all doing that anyway, but I think, I'm upping my game right now in terms
Yeah.
of being diligent about my dog.
Absolutely. Yeah. And, and I think the people here probably kind of already know what I'm going to say, because they're already proactively concerned with their dog's health. But just to reiterate it, because it's all good refresher too. The more you hear things, the more you remember,
Right.
but things like it's warming up, the last thing you want to do is, tax your dog, like walk him in the middle of the day, walk him in the middle of the day, and God forbid, like, he has some heat stress, and you don't want to add any more to your plate right now. So, walking early in the morning if it's warm climate where you live, so we don't worry about heat stress or like pad burns, things that could be definitely avoided. You don't want to be taking your dog to the vet for that right now. It's kind of the same principle, like, if your dog doesn't have perfect recall, just make sure they're leashed. I am not one to get into the leash versus non-leash debate, on the Facebooks or
Yeah.
Facebook groups. But if you have a reactive dog, or a dog that's not 100% on his recall, just keep him leashed, just to keep things extra safe. Because the last thing your veterinarian wants to be dealing with right now is a dog fight wound that could have been avoided, things like that. And we talked before about, just playing it really, really safe with your dog's diet. It'll be interesting to see what happens here, because we might start seeing more and more telemedicine and veterinary medicine after this, which I'm excited about, because I already like the online space. But some things can be taken care of via telemedicine. For example, if your dog has acute diarrhea, from, something he ate, that can be probably treated over the phone. But other things, like you had mentioned before, Jane, like pancreatitis, like if you, feed your dog something like bacon right now, and your dog has pancreatitis and, he can't stop vomiting, that unfortunately is, a medical emergency, and that puts your dog in the clinic.
Yeah. So tell us, just in case anybody here doesn't really know what pancreatitis is, can you give us a little bit of information about that? And also, you said don't feed your dog bacon, but I know rich foods can bring on an episode of pancreatitis, which can be really serious.
Yeah, it can be. I mean,
Life-threatening.
Oh yeah. I mean, overweight dogs are more predisposed. And then there's probably a genetic predisposition.
Disposition.
You know what I meant. What was my word? So schnauzers, for example, if I see a fat schnauzer, that's like a ticking time bomb. No offense to the fat schnauzers out there, but they are going to get pancreatitis. They are. So schnauzers you should be very, very cautious with them. But really so pancreatitis essentially, again, fat dogs are predisposed, but your pancreas releases enzymes that help you digest food, right? Well, it gets I've explained it this way to clients before, and it really hit home, and I've had good success with it. But think of your pancreas releasing all these digestive enzymes, not into your gastrointestinal tract, but in your dog's abdomen or into his bloodstream, because that's essentially what pancreatitis is. Think of it as the pancreas is so inflamed and agitated from all these high fat foods that it starts essentially releasing these enzymes not into the gut but everywhere else, and it essentially
not good.
No, and it's incredibly painful, because think about it, they're releasing all these digestive enzymes into their abdomen.
So in order to steer away from pancreatitis, avoid rich foods, avoid feeding your dog would ice cream be something to steer clear of, or?
I would, just to be on the safe side, because they might not get pancreatitis, but they also might just get they might not just, but they could get gastroenteritis, just like a stomach upset like we would get, you know? So anything that's going to be like anything that your dog could get diarrhea from or vomit from, obviously you're adding to your plate, like one more thing to worry about and stress about. And like, is this too serious? Do I take them in, you know? So just staying away from those rich foods just to keep their gut health, you know, up. And then also too, to avoid, yes, the dreaded pancreatitis, which, you know, older dogs do tend to be more predisposed than younger ones with the pancreatitis. So,
yeah,
so
you know, when you talk about keeping dogs leashed.
yeah.
So the other day, my dog Ollie, we have to be really careful with him out in the front yard because there's a field. He loves to go out there. And he took off yesterday, and I found him out there just munching a dead cat. So there are a lot of coyotes in our neighborhood,
Oh,
and
no.
unfortunately, they like to eat the cats in the field.
Yeah.
Anyway, so could he get pancreatitis from eating a dead maggot-infested dead cat that he found?
The possibilities are endless. I'm just kidding. No,
I mean, not to be gross and graphic, but like, you know, I didn't. That's the kind of thing that can happen when you turn your head.
It is. And see, and these things are going to happen no matter how proactive you are. And so it's not like, I don't want to be like placing, like, I don't want to put any guilt or shame or anything, because if these things happen, they're dogs. They get into everything, do they not? And
Right.
I would just say, you know, monitoring really closely for vomiting and diarrhea. You know, I don't know how much he ate, but, you know, foreign body comes to mind, but also too the bacterial overgrowth. You know, he could get some, you know, he could have like some gastroenteritis from that for sure. So it just depends.
Yeah,
And
it moved through pretty quickly. There was some really nasty.
Oh God, I'm sorry. That sounds awful.
Yeah. Other than
He's
that,
a Labrador, so I'm not as worried. So those labs have resilient guts. I had one with like 2 or 3 corn cobs, foreign body, and it was actually, no, it was litter mates. They both had corn cobs, 2 or 3 amongst the 2 of them.
they ate them.
They ate them, and usually corn cobs are like foreign body surgery. You have to go into surgery because they're not going to pass the corn cob. And the owner couldn't afford it because he had 2 big labs that both needed foreign body surgery. So he's like, I'm just gonna have to monitor. I'm like, okay, these are the things to look for. Those dogs passed those corn cobs. I've never seen a dog pass a corn cob except a Labrador. So
that's impressive. So anyway, besides pancreatitis, what are some of the other things that we should think about to keep our dogs healthy right now? And also,
sure.
how do we know, because dogs are dogs. So how do we determine between what's like a normal diarrhea, like, oh, my dog found this old dead animal, or, you know, versus something that's really serious and I need to take them in to the vet to get checked?
Yeah, absolutely. And you know what, if it's okay with you, Jane, I'm going to go through this verbally, but I have a good blog post, and I also have a good reference. Like if you guys drop me your email addresses, I will send you these references, this blog post, and this it's like a list, right?
Okay.
But verbally just going through it. So for example, so seniors and young dogs I'm more concerned about, because they can dehydrate really quickly. If you have a otherwise normal, healthy adult dog and he has vomiting and diarrhea, I'm usually okay to monitor symptoms and try a bland diet. Bland diet meaning rice or plain boiled chicken for, you know, a day or 2, all the while monitoring their hydration status. This is where I always tell my members, like, it's really, really important to practice your physical exams so you know what's normal before your dog gets sick, right?
Right.
So and that's a really good quarantine exercise to do, is to start practicing your physical exams daily, because if you're not working, you have more time now. And then, so vomiting and diarrhea, keeping an eye on their hydration status, asking yourself questions like, are they able to drink and keep it down? If they're drinking and keeping it down, I'm a little bit more comfortable with that. If they're vomiting water, or the vomiting is nonstop, or if there's lots of frank blood in either the vomit or the diarrhea, I'm more concerned. Things like that. You know, if it's vomiting and diarrhea that seems to resolve over the course of 12 to 24 hours with bland diet, and just some supportive care, I'm more comfortable. But if it becomes an issue where it's greater than 24, 48 hours, or if the dog starts acting sick at any point, if the dog is bouncing off the wall still, I'm a little less concerned. but it's a case by case basis. Some dogs come in bouncing off the wall and they have a foreign body. So just knowing your own dog is really important too. Like if your dog is down in the dumps and he's one that's never down in the dumps, I would be more concerned, and I'd want to see that dog sooner than I would, the dog that, so it just depends. More so than the dog that's not as stoic and every little
Right.
thing upsets him, right? So just knowing your own dog, practicing your physical exams so you know what's normal, and then those things can potentially be okay to monitor. Anything that's urinary, so if, for example, they are, straining to urinate but not urinating at all, that's a medical emergency. Anything neurological is an emergency. Potential toxicities. Let's see, any bloating of the abdomen, we worry about GDV and those guys that are bigger dogs,
Yeah.
any massive trauma, God forbid, hit by a car, anything like that. Those types of things we consider medical emergency. Any like respiratory distress, difficulty breathing, changes in respiratory patterns that last longer than 12 to 24 hours, are all things that I would consider an emergency. Any eye issues, if your dog is squinting one eye, I worry about ulcers. I want to see those dogs right away. Things like that. So
Okay. All right. And I kind of interrupted you midstream when you were talking about pancreatitis, but you were talking about, just right now is a time when a lot of veterinary offices are on reduced hours and only really dealing with emergency things. So it's good for us to be able to handle things at home and know the difference between what's normal and what's really truly an emergency.
absolutely, yeah. And I'm just understanding too that essential service, quote unquote, is going to vary from vet clinic to vet clinic and from state to state. We can't give you like a list of essential services, but any of those things I mentioned there would be considered an essential service, because that could be potentially life or death, or anything that's causing pain or suffering on your dog's end is an essential service. Things that are gonna require extra PPE, like elective procedures, routine dental cleanings. Those need probably to be postponed. And I don't want to speak for your veterinarian, but we just need to assume that this is going to get to every county and every city, and that PPE is going to be short. And that includes vet clinics, not just our hospitals. And also too, just to encourage the social distancing. If we have people coming in for nail trims or for, non-essential vaccinations, then that is increasing everybody's risk, including the staff. And we have to use more gloves, and we need to, for expressing anal glands, for example, unless they're infected. We have to use gloves for that. Those might be in short demand here before we know it. So things like that we don't want to expose the veterinary staff, and we don't want to use their PPE either. So all things to consider. And I mean, there's been a lot of questions actually about the rabies vaccine, because obviously it's required by law. Right now it's still very much a case by case basis, but if it's a puppy who's never had a rabies vaccine, or it's their first booster, like 1 year old, that is absolutely an essential service, because chances are that dog does not have enough protection against rabies virus. And that's a zoonotic disease, different discussion, but
Yeah.
that's obviously something we still need to that is absolutely an essential service. If it's a person who's immunocompromised, or has been exposed to the virus, and it's a dog that is overdue for a rabies vaccine and they have nobody who can bring it in, as long as that's an adult dog who's had several vaccinations, I hate to speak for anyone, but I have a hunch nobody's going to find that person, or, but it's best to call your vet and ask. But rabies vaccine is still a very big gray area for this particular.
So if my dog is a month or a few weeks past due for his rabies vaccine, that's probably not an emergency, correct?
And I would just call your vet just to verify, because I'd hate for anybody to get fined. But if it just depends. If you're in New York City and your dog is a couple months overdue and they're literally only doing emergencies and they're swamped, your vet's probably going to tell you to, wait 2 weeks. If you're in an area where I'm at, and, we've only had 3 cases in our county so far, and your pet's a couple months overdue and you've not had any exposure, or, that of, we're probably going to give your dog rabies vaccine, but curbside, you know what I mean? So they go right now here where we're at least, we're going out, we're getting the dog and we're bringing them into the clinic to keep the waiting room empty. So it's highly dependent on where you're at. And I'd hate to tell you to be like, oh, you're fine. And then fine.
All right.
So
was there anything else you wanted to touch on before we open it up to questions?
I don't think so. I think that really covered everything.
Okay. The one thing we had talked about earlier that you didn't mention is, many of us are interested in raw diet, but have never fed it because it's time consuming.
Yeah.
Now is probably not a good time to switch your dog's diet or make any big changes, correct?
Agreed. Yes. That's funny. I kind of said that joking, but I meant it. Now is not a good time to be experimenting with new diets, especially one that could potentially, and that's actually a really, really good point though, when you feed raw diet, you have a higher chance too of a foodborne illness because, you have more salmonella in your kitchen. Even if you're really clean, there's a chance that you could get a foodborne illness from feeding the raw food diet. And people do die from foodborne illnesses. And once again, you don't want to be doing anything to yourself or to your dog that puts you at potential risk to be at the hospital when,
don't want to go
already taxed.
Don't want to go there.
Now is, gosh, my boyfriend broke a wine glass on accident the other night, and I was like, thank God you didn't, I would have stapled him before I was taking him to the emergency room, like we're not going there. Okay. You don't want to do anything that's going to put your dog or you at risk for being, taxing our healthcare system right now. It's everybody doing their part. And I heard somebody say, this is really a community effort, community by community, I think we all as pet owners, we all have, it's really going to take a team effort from every community and every individual person to, mitigate the risk and the exposure and, keep everybody safe. So.
Okay. And that's important. We're really all in this together.
Absolutely. Yes.
Yeah. So I've got one question here. I'm going to bring Joy on, but if anybody else has a question, go ahead and raise your hand. But I'm going to unmute you, Joy. I think I'm going to unmute you.
Yeah.
Joy, I think you're live here.
Great. Hi. Thanks. Can you hear me?
Yes.
Great. So I kind of have two questions, one of which it's a large animal question, so you may not be able to answer, but where I am, there are still some dog walkers working. So dogs are going out, 4 or 5 to a dog walker. And I'm not sure if you quite touched on this, but what is the transferability from dog to dog? So that's my question one. And then question two is, we're also a big horse community among my network and what I do. I was wondering if you had anything to say about that on large animals.
With the dog walkers, I know I follow some like group dog walkers on Instagram, and I've seen a few of them have discontinued services for now. As far as risk of transferability, as far as a fomite, I would say walking outdoors, it's pretty low risk, because the virus is probably only going to last on their hair coat for a couple hours, and then you add in the wind and, the sun, hopefully, and probably pretty low risk. The problem is we still don't know enough about, the transfer from dog to dog. There's just not enough information really to give you a good, accurate answer. I would say for me personally, I would probably not be sending my dog to a dog walker. Even if I was working full time right now, I probably wouldn't, just to play it safe. And that's my personal preference, just because until we know for a fact that it is not actually infectious in dogs. We strongly disbelieve it isn't, but there's just not enough science out there to prove that. And that makes me a little uncomfortable. There's just so much more research that needs to be done to tell what animals are going to be a source and which aren't. Dogs I'd probably say cats are more inclined to be a carrier than dogs, because they have it's been a long time since I took virology, but they have a stronger receptor on their lungs for, the SARS virus than dogs do. And we're comparing this a lot to the SARS virus, obviously. So I would just make me feel uncomfortable. Once Walter got his bath, he stayed home. But it's going to be on a, case to case basis again. And I wouldn't say that's an essential service, but it depends what state you're in. So in Illinois, technically dog walkers, and I know for a fact they're not doing grooming, and I would assume dog walking is in that same category, that's not an essential service. So if you're in a state that's not, shelter in place yet, it's probably legal, but it's just, I probably wouldn't be partaking it for me personally, but it's hard to say. Does that answer your question there?
Yeah.
I wish I could give you a more definitive answer. It's just, there's just so much we still don't know. And I'd hate to come back 6 months from now and be like, turns out that, but highly doubtful. Unfortunately, we live in a country where there was a big scare, when people were saying, oh, dogs can get it. And, I know in several countries, there were people doing awful things to dogs and cats because they didn't want them to be a source, of infection. Luckily, we live in a country where, while that could potentially be a smaller issue, it's not as big as in other countries. And because we have such a strong human-animal bond here, fortunately, I don't think we're going to see that quite as much. But I don't want to fill our shelters because everybody thinks that they can get coronavirus, but we still just don't know.
Yeah,
so
that makes sense.
Okay, I hope I didn't confuse you more. So, and then as far as large animal goes, so horses, gosh, you're really testing my knowledge here, but I think pigs are more of an issue than horses because same with cats, they have that stronger receptor. And I think the same principles going for any animal care facility where people taking care of those animals should be staying home if they're sick. And side note, I hate to get off on another tangent, but I've heard of veterinary staff getting exposed and coming up positive, and they don't close those clinics down. Instead, that person self-isolates, and anybody in direct exposure, basically they're told you can work if you feel comfortable, or you can, self-isolate. So, and that's going to be, again, a county by county, state by state basis. But I think pigs are more of a concern than horses, but like with anything else, people who are sick should absolutely be staying home and not taking care of those animals. That was your question there, right?
Yeah, no, I think that answers both my questions. Thank you.
Okay, no problem. My pleasure. So
Great. Does anybody else have a question? I don't see anyone else's hand raised, and I don't see anything dropped into the chat. I'm going to go ahead. Is there anybody else that has a question? No, I think we're good. I want to thank everybody for coming by today. And if you're interested in being entered into the drawing for a 1-month free membership to Wanderdog First Aid, please drop your email in the chat. And I'm also going to be giving away a bottle of our hip and joint supplement. And Libbie, thank you so much for coming by and talking with us today. I really appreciate it. And
my pleasure.
Also, be sure, if you don't already follow her Instagram handle is Wanderdog First Aid, and she posts lots of great, I think do we have any other questions? No. Mel, I'm going to unmute you. Did you have a question, Mel?
No, I'm good.
Okay, awesome. And also, if you're Wanderdog First Aid follower, then go ahead and follow us at Wagworthy Naturals on Instagram. So thank you again for coming by. We appreciate it, and it's great to see everyone here.
Thank you, guys.
I'm going to unmute everyone in case anyone has anything they want to share. Let's see. Unmute all. Okay. Hey, Corrine, are you still here? No, she's gone. Anyway, thank you for stopping by today. Sari, it's great to see you.
Hey, this is Lauren. I did have a quick question. Could you tell us a little bit more about Wagworthy Naturals, because I'm not familiar with it at all?
Sure. Lauren, do you want to, so Wagworthy Naturals, we make healthy natural supplements for dogs. You can check out our website, which is wagworthynaturals.com. And right now, we're a relatively new company. We have our hip and joint supplement, which is really great for active dogs or for older dogs that might have stiffness or arthritis. And you can also, Lauren, if you want, email me. You can reach me. My email address is jane@wagworthynaturals.com if you have additional questions. Do you have any specific questions about Wagworthy Naturals?
No, I just wasn't familiar. I will definitely check out your website. I just didn't want to pretend I knew what it was. Because
no, that's great. Thank you. I appreciate that. That gives me an opportunity to share it with everyone. And I'm grateful that you stopped by today, and I hope you took away some helpful tips.
Thank you.
Yeah. All right. Take care.
Thank you, Jane, for putting this on. This was fantastic. So
You're welcome. I'm just going to unmute let's see, unmute all. All participants are unmuted. Okay, so some people have unmuted yourself. Yeah, thanks for sharing. I appreciate that. And I read the thing about the dog in Hong Kong who had tested positive, but from my reading, it seemed like that dog had it on its fur and not in its bloodstream. But I haven't kept a pace with that. And that's interesting that they think that there may be dogs that actually have it circulating in their bloodstream.
yeah, that was like I said, when I actually was just doing research a little bit of just to make sure I was up to date on everything, because gosh, it's changing so quickly. It's impossible to stay up on it. I had gone back to that original article, and I don't know if it's the same article, because the one I was reading is in our veterinary forum, and the unfortunate thing is they were able to repeat that PCR, so that's what was making them think it was less likely to be a contaminant. And then I found it a little bit disheartening when they tested the blood, and they did find an antibody response to it. But again, does that really mean anything in the big scheme of things? I mean, because there's been no spike in respiratory cases, in the United States, and as far as like Hong Kong goes, I did not find anything saying that. So the dogs aren't symptomatic.
When you say respiratory, you're talking about dogs having respiratory issues.
Yeah, like coughing, sneezing, hacking, runny nose, runny eyes. So the fact that dogs aren't showing symptoms is, again, just driving home that important point that at this point we don't think they're infectious, but it's better safe than sorry, since we don't have all the definitive answers yet.
Yeah. Okay. And are state veterinary labs collecting information? When you said, if a dog comes into a clinic right now and has a respiratory issue and they're swabbing the dog, did they then send that information into like a state veterinary examiner or a state veterinary office or a federal, or is there any kind of oversight?
No, and not at this time, as far as I understand, because it's not yet a reportable disease. Because we've not yet proved that it's actually infectious in dogs. So the laboratories I'm referring to are called Antec and IDEX, and they're just two independent veterinary diagnostic laboratories that are doing the surveillance.
I see. So in other words, veterinarians are sending their tests in to those laboratories to get their results back. And so they're just surveying and paying attention to what's going on.
Yeah, so just to be absolutely clear, the vets aren't sending these samples in saying test for COVID-19. They're sending them in as like a piece, like in the computer, it's called like a PCR upper respiratory panel. And so when we send that in, we're assuming they're testing for like kennel cough or canine influenza. So they did this on their, as far as what I understand from reading these articles, is they did it on their own accord, as far just like to have surveillance. And the reason I say that is because I don't want to make people think that they can go to the vet to get tested for the COVID-19, because we don't want to be pushing that at this time, since there's no proof that this is actually it's infecting dogs, but it's not making them infectious.
Yeah. So, okay. I understand.
And not showing symptoms. So,
and then our veterinarians, and we talked about this before, but I bet there's other people that are interested. Are veterinarians seeing any shortage or challenge with getting PPE at this point in time?
Yeah. Even like surgical masks, gloves, and that's why, and that's another huge reason they've discontinued any elective procedures, like, spays and neuters, routine dentals, simple mass removals. So that is it's not because we can't do it safely, especially in a town like I'm in, where we've had there is community spread. So I mean, it is the responsible thing to do here. Right. But the main reason is to conserve PPE behind that.
Yeah, that makes sense. All right, good to know. And are your I mentioned earlier, I don't know if all of you were on the call, but then So our emergency veterinary clinic is closed here, and our regular veterinarian only has hours from 9 to 3. Are you experiencing the same thing where you are, or?
Yes, our emergency vet here in town did not close, but they are transferring a lot of cases. They didn't, and unfortunately, they sent an email out, but they did not give a real good reason why. They said they were referring a lot of cases to the university. And it's hard because the way our emergency clinic works in town is they're only open when the day clinics are closed. So
Right.
there's a lot of opportunity for contact there, like animals being hospitalized overnight. The owner comes in, they're exposing the vet staff, and then they're taking them to their own vet clinic where they're exposing, so there's a lot of social interaction, handling the animal and getting them from clinic to clinic and back and forth. So it's a little bit unique that way. And I think that was my interpretation, at least.
Okay, that makes a whole lot of sense.
Yeah.
All right, great. Well,
I'm sorry. Yeah.
No, is there anything else you want to add to that?
Just one more thing that people don't think of is, we still need to isolate these pets, because if they are fomite, they still need to be isolated just to keep the contagion down. And,
Yeah.
People don't realize I work in a lot of different vet clinics as a relief veterinarian, and a lot of vet clinics simply don't have the space. Like some isolation wards are literally 4x4 rooms. A lot of vet clinics don't have, and I know for our emergency clinic in town, after working there, their isolation is minimal. It's not like these hospitals where you have these giant, wards of isolation. Vet clinics unfortunately don't have that luxury. So that's another real hard, a lot of clinics are struggling with that if they do need to isolate for whatever reason.
Okay. All right, great. Well, thank you again. This was really a lot of fun. And I don't know,